I think this is the last question, but just hearing you
Yeah.
talk pretty extensively about peritoneal, what do you see is from your experience peritoneal superior for patient outcomes over home hemodialysis? And what does that look like? Is there an opportunity where it makes more sense to align with peritoneal staff support?
Ooh. Yeah. I mean, general, like I said, one, the hurdle of self-cannulation, which is a huge one. Two, two, not chopping up their arms and having these accesses, using up their vasculature, right? Like again, not using up their vasculature or arm and the negative aesthetic look of it in someone's arm. Two, three is, I mean, I just think, low exchange is done every day on dials on a peritoneal. Like one takes away a lot of, because it's so gentle, it takes away a lot of that hemodynamic instability and blood pressure drops that can happen. That can happen and help preserve a lot of kidney function still. You know what I'm saying? It's like it's always cool to see a PD patient still peeing. You know what I'm saying? So it's nice to have them actually still peeing because the kidneys do a lot more than we think they do. Like there's a lot of the things they filter and clean that we may not be aware of. So them retaining the ability to urinate is kind of crucial. That's what I've always hated about in-center HD in particular, because we just suck these people dry on
Mhm,
dialysis on the
mhm,
Monday, Wednesday, Friday, Tuesday, Thursday, Saturday kind of schedule. We just suck them dry, and we
mhm.
just don't leave enough room for them to actually urinate. But also, I think that those are the key factors where I kind of lean towards PD over 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 HD. And not that home HD is bad. I'm not saying that. I think it
Mhm,
could be a transition point, right? Like meaning you've done PD. Hey, you like being at home. We got this option of home HD next. Do you see what I'm
mhm,
saying? I don't think.
mhm,
I think you have to stop thinking of it as like
mhm.
a all or none. It's like
Interesting.
almost like a journey, right? It's just
Mhm,
like someone gets like you someone the way I look at, like, even when I explain to my patients, like I always say, hey, we're going to do PD for a few years, but your end goal is a transplant, right?
mhm. Right.
So like you can't start like looking at PD as the endpoint, transplants the endpoint, home HD is the endpoint. It's going to be a journey over time. They may even do in-center for 6 months. Do you see what I'm
Mhm,
saying? It's not a failure. They may just need at a certain phase of their life don't have a home situation that's amenable, but they can be reapproached later and say, hey, let's do that. So that's where I think care coordination is so crucial. So.
yeah. No, that's great perspective and a good continuum that you're able to explain there.